Welcome back to the Redemption Physical Therapy Podcast, the podcast that helps you move better, recover faster, and perform stronger. I'm Frederick,
I'm Marissa.
and today we are talking everything ligament sprains. Okay, so what we're going to get into is what it is, how it happens, healing timelines, common mistakes, and a simple protocol for each and every healing phase. So we're going to dive right into it, starting off with what is a ligament sprain?
So I think it's first important to understand what a ligament is, right?
Yeah,
So
for sure.
ligaments, different than a tendon or kind of similar to what we talked about muscle strain wise last time, right? A ligament attaches bone to bone, right? So you think of like the ACL, right? It attaches a piece of the bone to another piece of a bone, right? What a ligament sprain is very similar to a muscle strain. It's just the ligament has become stretched, overstretched, or even possibly torn. There's grades to it, just like anything else. And it is when the joint, we'll say, is like forced beyond a range of motion that it's able to handle,
Okay.
right? So that is how it tends to occur. It can be traumatic, just like any other injury, or it could just be, again, that we overloaded our joint into a range of motion that we weren't prepared for, weren't able to control or handle, and here we go. We have this ligament strain.
Okay. Got it. And I mean, you already kind of hinted on how it happens,
Mhm.
the capacity overload, basically, or some type of trauma,
Yeah.
right? But yeah, just kind of go over like maybe those two cases, right? So
Mhm.
how it actually happens.
So you think of, let's take an easy example, the ankle, right?
Mm-hmm.
An ankle sprain. I step off a curb and I roll my ankle, right?
Mm-hmm.
So those ligaments that sit on the outside portion of my ankle, so they basically attach my lower leg to my foot bone. The foot bone is connected to that's not true, guys. That's a stupid song. But anyways, I step off the curb and I overstretch those ligaments on the
Yeah.
outside. Doesn't always result in a tear, but again, I have forced that my foot into a range of motion that that ligament was not able to handle.
Mm-hmm.
They are stabilizers; they're meant to handle a certain amount of range of motion.
Right.
But if it's traumatic and it's applied in a rapid manner that we're not able to kind of counteract, then we can have a ligament issue or a ligament sprain or tear at that point.
Got it.
Yep.
Okay. Okay, so now let's go over some of these healing timelines. All right. So if you have a grade one, and then what that actually is, right? And some of the symptoms of the grade one.
Yeah, so the grade one is, kind of the easiest one in a sense. So you definitely have overstretching of the ligament for sure. You may have some micro tearing, maybe, but usually it's still intact. The ligament's still intact. It's just overstretched. It just needs some time to kind of remodel and repair. You may have some swelling. There's possibly pain involved. Again, they're usually mild in nature. It depends on the person. Pain science is a whole nother thing, right?
Yeah.
But these are usually, depending on the severity, 1 to 3 weeks you're looking at. You might have to modify some of your activity. You'll have to regain your range of motion. There's a little bit of a protective phase that we have to go through. But within 1 to 3 weeks, a grade one should be feeling pretty good at that point.
Okay. And getting into grade two.
Grade two. Now we're getting, the degree of injury is larger at this point. So not only have we overstretched, there's likely some partial tearing at this point. So with the swelling, that's probably going to be there, just like the grade one. With the pain, there's probably going to be some bruising involved as well. So the bruising is kind of our sign that we've kind of entered into a higher grade sprain at that point. Right. And you think of your ankle, you know what I mean? So, and a grade one can bruise as well. But again, you're starting to look at especially the severity of bruising can start to indicate that there's a larger problem going on. So these obviously will take a little bit longer to rehab, just like that, just reasonably so. We're probably looking more into like a 3 to 8 week range at this point when it comes to the grade two. And we just have to remember that these grades are on a spectrum.
Right.
So grade two, there are some grade twos that can probably heal in 3 weeks.
Yeah.
Our more severe grade twos, they're going to
Hmm.
take a little bit longer.
Right. And when you're saying healing, because some people might be like, oh, okay, it heals after 3 weeks, so I'm good to go,
Good to go.
good to get right back into my activities that I was doing before. That's not the case, right?
That's not the case, right?
Okay.
Exactly. So yeah, we think when I say healing, you think more like biological healing, like the actual tissue, the tear, whatever that has healed in the sense that scar tissue has laid down, right?
Hmm.
You know what I mean? Do we still need to go through the strengthening phase, the remodeling phase? We talked about with the muscle strain, like these fibers, we want them to remodel so that they're organized again. They're in an
Hmm.
organized pattern, not in this like scar tissue sticky glue pattern.
Yeah.
That takes time, right?
Yeah.
So yes, we can get the scar tissue laid down. We can get the kind of biological healing starting in this
Yeah.
time frame that we're talking about. But the strengthening phase, the stability phase, the gaining the proprioceptive, the awareness, that spatial awareness, that all takes some time afterwards.
Got it. Good to clarify on that point.
Yeah.
And then finally, the grade 3.
Grade 3. Yeah, we're looking at more of a full rupture at this point, right? So, take the ACL, like a full
Mhm.
ACL tear. Do all of these require surgery? No, it depends on the ligament. A lot of people are living with grade 3 ankle tears, but what they have done,
Mhm.
right, is they've likely gone through a pretty strenuous strength training program and
Mhm.
proprioceptive awareness program.
Mhm.
You think of the ligament, it's a passive stabilizer. And I
Mhm.
say passive because there's no muscle portion, there's no contractile portion, right?
Mhm.
It's just a passive structure. But it is a stabilizer. So when we lose that, whether it be the ACL, the ankle, the ATFL it's called, when we lose that, we have to either get it surgically repaired, to regain that passive stabilization, or we have to get our stability elsewhere, right? So then
Okay.
we start to strength train around the joint, right? Because our tendons that cross that joint can act as stabilizers,
Mhm.
right? And then there's also a bunch of like, connections. That's where that proprioceptive awareness comes in, that spatial awareness, your body's ability to know where the joint is in space. We can train that as well. That's where a lot of our balance training and our stability training, that type of stuff comes into play. So, with very, very strenuous protocols, we can regain that stability at the joint even without the passive structure. Again, it depends on the joint, it depends on the person's body, and it just depends on the severity of the injury.
Okay. Got it. And the healing time frames for this one, did you
Oh, I didn't say
yeah.
that. No, yeah. So this one's same thing. If it's looking at surgery, then yeah, we're looking at months and months of rehab. If we're not going for surgery, I mean, I honestly recommend, probably 4 to 6 months of rehab, honestly, and that includes some of the biological healing that'll occur. You know, will a tear completely heal without surgery, like a full rupture? It may or may not. There's some crazy studies out there now that do show that there is some spontaneous like
Mhm.
ACL healing. There probably needs to be a little more research that gets done on these. So, like I said, will you be able to actually heal a full rupture without surgery? Maybe not. Still doesn't mean surgery is necessary. But you are looking at a like 4 to 6, if not longer, month rehab protocol.
Got it.
Yeah.
Okay. All right. Moving right along into the mistakes. So, here are some mistakes, and they're kind of similar to the muscle strain, right?
Yeah.
Because I mean, strain, sprain, we kind of treat some of these things the same way, and people usually make the same mistakes with them.
Yep.
So, let's start with number one, icing. Right?
We should start every podcast with, that
It's
should be
like,
our opener.
right.
Um, ice, I think it's even a little more prevalent with ligament sprains because I think
Mhm.
we get a little more versus like a muscle strain. You get a little
Yeah.
more swelling with
Mm.
with especially you think of like the ankle, right?
Ankle, yeah.
Ankle sprains, right? They swell up.
Yeah.
And I think in our head we think, okay, oh my God, I need to ice, I need to, decrease the swelling. And again, what we have found is that it's definitely delaying healing, especially when we put it on immediately. Like that
Mhm.
inflammation, that inflammatory response to a just an acute injury is the body's way of just like trying to 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 heal as quickly as possible,
Yeah.
right? When do I ice? We talked about this last episode, is if I am having trouble controlling swelling couple weeks out.
Right.
You know what I mean?
Yeah.
But acutely, I try to avoid the ice because the body is trying to heal what just happened.
Mhm.
And with the ice, we are shutting down or decreasing the blood flow to the area. And that's where we start to have a delay in healing, which can be detrimental in the future.
Yeah.
Yeah,
Gotcha. And just like you said before, right? Like only if um it's uncontrolled after we try interventions besides ice
exactly.
to get the swelling down or to allow it to, do its thing because it is doing its thing because that blood flow is bringing those healing properties to that area to speed up that healing process,
Exactly.
right? So slowing that
Yeah.
down with
Give it a
ice, yeah,
chance.
yeah, yeah, just give it a chance, right? But if it lasts for an extended period of time is when we're just like, okay, our interventions aren't working right now. Let's do something about it. And there
Yeah.
might be other underlying reasons why that swelling is staying around.
Hmm.
But if we can't get the whole picture and we're not getting fed all the information, then we just have to do what we have to do and, potentially use the ice at that point.
Yes.
Okay, so we know we're
Yes.
not icing as the initial intervention.
Ever.
Okay. So that's mistake number one. Mistake number two, returning to demanding activity too soon.
Yeah. So, and this can be for any injury, but yeah. So, we'll keep the ankle as a good example,
Hmm.
right? You know, the just weight bearing, just kind of
Yeah.
bearing, and this will limit the ability of the body to again transfer all these healing nutrients in and out, right? Because we
Hmm.
mentioned last time, not only are we bringing nutrients in, but we're taking debris out, and
Yeah.
we're flushing out stagnant inflammation and all these things that don't want to be in the joint, right?
Right.
So if we are returning to demanding activity or weight bearing or whatever, right, too soon, not only are we causing pain that,
Yeah.
and we're increasing inflammation, but
Hmm.
we can also be kind of limiting all of these processes that are bringing good things in, bad things out,
Yeah.
right? So just delaying everything. We're delaying healing. Plus, we're putting ourselves at a higher risk of injury of something else. You know what
Yeah.
I mean? Because if the ankle's not ready for the demand, well,
Hmm.
something has to take on the demand.
Right.
You know what I mean? So then we start thinking, okay, well, are we, injuring the calf, the knee, the hip,
Hmm.
the back? A
Yeah.
lot of people they'll start like walking with a limp and then they have
Hmm.
back pain 3 weeks later, and it's like,
Yeah.
yeah, because you're compensating.
Yeah.
Yeah, so that's, I think more or less that's probably the bigger concern is that something has to take on the demand when that joint can't handle it.
Right. So the movement compensation. So you go back too soon,
Mhm.
then that specific joint, like we said, the ankle isn't actually prepared or ready for that loading. And one thing that we've probably don't think about too often is just that when we have that injury, the nerves in that area get damaged. So that sensory feedback isn't as strong as it used to be.
Yep.
So just like you said, like now other things have to take up the slack,
Mhm.
and then we could potentially get an injury of the chain. So we have to retrain those sensory
Yep.
patterns, just like you said, with the proprioceptive stuff. So
Yep.
I remember when I was doing more research on the ankle sprains and just about like return to sport or activity in general, that one of the things that they said was the majority of people, they end up having another ankle sprain
Yeah.
because the pain goes away really quickly. The pain goes away so quickly, and they're just like, "Oh, okay, it's better." But they never did any balance training to start with. And when I say balance training, believe me, my former classmates know I do not like Bosu balls. It's just a thing. I'm like, before you do a Bosu ball, just do single leg stuff first. If you if you can't really balance on a single leg, you don't need to be balancing on a Bosu ball. That's just me. Okay, I'm just saying. But maybe even a foam pad, like you could use a foam pad, right?
Yeah.
Like, but
Stand on a pillow or something.
but the point here is just that when they introduced more proprioceptive biased movements within that rehab process, they saw a huge reduction. And I don't want to get the numbers wrong, but it was over 50% reduction in reoccurrence of ankle sprains.
Yep.
So one of the biggest things here is just that even if you have any type of sprain, even if the pain is gone, you do want to reinforce that balance component, especially with the ankle sprain, because of what the research has shown over time. But I digress. On to the next one, complete rest. So the third mistake.
Third mistake, complete rest. Yeah. So yeah, there's a balance between jumping back in too soon to demanding activity, but then just completely resting. As we talk about circulation and blood flow and things like that, it requires movement. It
Mhm,
requires muscle pumping activity. It
mhm,
requires, so if I'm just sitting and just letting things be stagnant, again, I'm probably delaying the healing process. And it's also not even a necessary thing, So we not only can we do modified movement of the actual injured joint, but we can continue to train other body parts, so that one, we stay conditioned, we stay healthy, we stay fit, whatever. But we also stay with like systemic blood flow. If I'm
mhm,
just laying in bed or just laying with my foot propped up because my ankle's injured, like none of my systemic systems are flowing,
mhm,
right? So keep maintaining that, especially in an environment of injury, is going to be super important.
mm.
And that's where we talk about, the gentle movement. I mean, even with an ankle sprain, you can get on a bike erg.
Yeah,
You
yeah,
can you could do that. You'll be
yeah.
okay. So yeah, so stuff like that, complete rest is very often not
Complete rest is a big no-no.
big no no.
Big no-no.
Yeah, unless you have like a fractured neck or something, we just then we'll go.
Right, right.
Yeah,
But we're talking about ligament
hopefully you're in
sprains
the
here.
hospital.
We're talking about ligament sprains here. Okay.
Facts.
So with that, like, yeah,
Yeah.
yeah, complete rest, maybe not. Now, with that complete rest too, just like what you were saying about the whole entire blood flow thing, I think people kind of may misinterpret it, but I do want to kind of give a little bit of nuance because it was just when I studied a little bit more of the anatomy and physiology, specifically when it comes to like warming up, right?
Mhm.
So the process, whenever you actually do start working a muscle, it opens up that area to more blood flow. So you may think like, okay, well, I am getting blood flow to the area, but you're not getting as much blood flow to that area until you actually start working that specific area. So I remember I was just like, oh,
Oh,
it was
yeah,
like I saw the Matrix. I
yeah,
was like, I know Kung Fu.
yeah. It's about improving circulation. Yeah.
Right. Improving that circulation. But yeah, so you're just increasing that area's ability to take in more blood flow once you're actually working that area. So again, it's not like complete rest is gonna allow that area to kind of like shut down some of that blood flow, and then it's just gonna continue to go around that area instead of it being opened up and letting that blood flow really flow into that specific area that needs those nutrients. Um, so yeah, the body's a cool thing.
Mhm.
Body is really cool.
Yeah.
As long as we treat it right. As long as we treat it
Facts.
right,
Yeah.
people. So
And
all right.
don't ice it.
Yeah. Yeah, stay away from the ice,
Ice, like,
okay?
is jumping
All
into
right.
cold plunges.
We're gonna have to make shirts. No ice over here.
Nice.
No ice gang. All right. So number 4. Sorry, kind of going off on a tangent here, getting a little too comfortable. Ignoring the injury. All right.
Yeah, so, and I think this kind of goes with, returning too quickly, like just simply ignoring that there is an injury, simply ignoring that there is a biological healing process and
Hmm.
time frame, simply ignoring that even after that time frame, there is a strengthening protocol, there is a stabilization protocol, there is a proprioceptive, like just ignoring all of these things, right? That doesn't mean that you won't get better and
Hmm.
return to your sport. Highly likely that you're going to re-injure
Yeah.
or injure something else,
Right.
right? Because we're not addressing the deficits at hand, right?
Hmm.
But yeah, so that's just, it just kind of plays into all of that,
Right.
right?
Yeah. And I mean, just like you were saying, like or another re-injury or potentially another injury. And the thing about comparatively speaking, from a muscle strain to ligament sprain, is that instability component,
Yeah,
right? So you jumping straight back into some type of dynamic movement, you can only imagine you have an unstable ankle
yeah,
and then you decide to do like a jump cut or something like that, or just like hopping onto one leg or something, and then boom,
yeah.
something happens up the chain right at the knee, you
Mhm.
know, or you have some instability going on at the knee because of the lack of stability there from a sprain that you kind of just like, I'll let it just, do its thing or whatever,
Heal it
and
by
then
its
heal a little bit. The swelling went down. I feel good.
yeah.
This movement feels good. Kind of flex your knee a little bit. You're just like, oh, that feels okay. I think I could get back into it. And then, you do something a little more quicker. And that response time isn't there either anymore. Again, like we said, you have to retrain
Yeah.
all of these things because the tissue is injured and then it injures those proprioceptive mechanisms that happen when we are doing those movements. So
That's where
yeah.
we get into, and you may have heard of chronic ankle instability. So,
Mhm.
not only are we increasing our risk for re-injury, are we increasing our risk for injury up or down the chain, whatever,
Yeah.
but you're also increasing your risk for long-term problems,
Mm.
and it's like, there's so many people, I'm sorry if this is you, like with chronic ankle instability. They're like, yeah, like I walk down the street and I roll my ankle. I'm like, you're not cool because that happens. Like, that's a problem. Like, that doesn't make you better than everyone. That actually makes you worse. Okay. But what I'm saying is that, like, yeah, like, and they're like, yeah, I used to roll my ankles in high school all the time. And now like they're just like so loose. And I'm like, that's a problem.
Yeah.
That's a problem. That means that you didn't address it, and
Yeah.
now it has become a chronic instability issue, right?
Yeah.
Which, yeah, like if you just randomly roll your ankle because you're walking without any type of external force or traumatic injury,
Hmm.
yeah, that's not a good thing. And like you said, that's a sign that, one, your reaction time is not where it should be.
Hmm.
If you're just walking, you roll your ankle, what are you going to do when you're running after a soccer ball or
Yeah.
something? You know what I mean? You're going to blow your entire ankle, if not your knee out as
Yeah.
well. So yeah, you start creating long-term problems. And
Hmm.
this chronic ankle instability, like I'm talking about like people my age, I'm only 36 by the way, but people my age complaining like, hey, like, yeah, in middle school, high school, I rolled my ankles all the time and now I have a problem. Like, we're looking at like 20 years later. You know what I
Yeah.
mean? Like, that's a problem, especially if
Mhm.
you're still trying to be active as a human, you know what I mean,
Yeah.
and dynamic and be able to move laterally, like all these things. Like, the future implications of these are is huge, and ignoring them at the time is that's how these future problems happen.
Yeah. Yeah. So just don't ignore those injuries.
Yeah, you're not cool.
Especially
Okay.
and then in their defense, like they may not have been taught like
No.
that around that time. And then they just thought it was a normal part of their lifestyle,
Mhm.
afterwards, and that they were just gonna have to deal with it. And that's the point here too, because you still can work on that,
Mhm.
right? Even if you've had this going on for an extended period of time, you can still address this thing right now. No, it's never going to be as good as it was,
Mhm.
but you can still address that issue by starting to really hone in on, all right, let's get some more strengthening going on in that area. Let's get some more stability work going on in that area. So that way you're not just walking down the street and roll your ankle.
Yeah,
All
sure.
right. I'm here to defend you, okay? It's not your fault. All right,
At
so
least you have
the
him.
the fifth thing is not addressing underlying issues.
Yep. So this is where we talk about the root cause,
Mhm.
So, and like I said, some sprains, they just happen because of trauma. It's like, in football you had a tackle, your leg got stuck weird. Yeah, like
Yeah,
there's certain things that happen that like the ligament can't handle, and it happened,
yeah.
right? Um if it's something that wasn't non-contact, or like you said, you're walking down the street, you roll your ankle, like we need to start figuring out like what is actually why we're doing this. Is it a chronic ankle instability problem? Maybe you have a tightness somewhere that causes you to walk on the outside of your foot.
Mhm.
You know what I mean? Because that happens too. You have a lot of people like, we talk about flat feet, people being kind of pronated, they cave
Mhm.
in. But there's the other one too, where they're very supinated, or maybe they
Right.
have super high arches.
Arches, yeah.
Yeah, their foot doesn't move well. Their arches are fixed and tight. And that can cause problems up the chain as well. So
Mhm.
again, we're being specific to the ankle, but this is anywhere, right?
Mhm.
So yeah, kind of just determining like what are the other factors that we can address, if there is an injury, so that we can get them back to where they were, but then better. You
Mhm.
know what I mean? So that maybe this doesn't happen again,
Mhm.
or we're addressing that tight foot so that their actual foot moves better, so their ankle can respond better to impact, to loads, to demands, whatever.
Yeah.
Yeah.
Yeah, no, very good point. Because I see it all the time just with coaching people that, when we initially have somebody and then we do an assessment on them, we see like, okay, what is the limiters? Like that's what we're looking at. Like
Yep.
what movements are good for you? And if you didn't address that thing that's going on at your ankle, and we just decided, okay, like you're good to go, and then we get you sprinting, we get you doing lateral hops with the med ball or something like that, and then all of a sudden, it seems like it's all of a sudden, and then you roll an ankle or something like that, or you blow your Achilles out, and you're just like, how did that happen? But all the while, this whole entire thing was going on, that whole entire mechanism. So a lot of times some certain injuries may seem like it's just out of nowhere, but really it was just an underlying issue that we
Yeah.
never looked at.
Mhm.
And that's why like I'm a huge proponent of always assessing, where you are. Um, Either like by your coach or by a therapist, like getting assessed regardless, not just jumping into random training programs or whatnot either. And I'm not bashing online programs, but again, if you're about to get into some like physical activity, and it's going to be pretty intensive, you definitely should get assessed first, so that way you know what's appropriate for you,
Yeah.
right?
Mhm.
Okay, cool. So moving into some simple protocols. So these are going to be simple protocols that's going to go over just different phases. So phase one, acute; phase two, subacute; phase three, strengthening; and then the phase four is going to be return to sport activity. So we're going to start off with phase one. So in this phase, what is our focus here?
So in phase one, that's the very acute
Mhm.
phase, right? So one, we're trying to manage swelling as much as we can, right? We're
Mhm.
letting the body do its thing, like we talked about, but we're managing as we can. There's manual techniques, soft tissue techniques, there's taping techniques, all these things that we can do to help just kind of maintain that consistent blood flow through the area. We're protecting the joint a little bit, so this is where we're not ignoring the injury, right?
Right. Yeah.
So we're protecting the joint, whether it be, maybe offloading weight bearing, maybe we are in a little bit of an immobilization boot or something like that, again being specific to the ankle, but we're in some sort of immobilization apparatus,
Yeah.
just to help with, protecting the joint right now,
Yeah.
right, acutely. And then eventually, we're also getting into gentle movement. So again, specific to the ankle, maybe we're just moving the ankle through just like natural ranges of motion. Like I tell people to kind of just trace the alphabet with their toe, right?
Hmm.
We're not going into ranges that cause a lot of tension on that ligament because it is still trying to heal. We
Right.
don't want to force overstretching.
Yeah.
But yeah, just gentle movement, getting on a bike, those type of things. And even just slowly activating the muscles around it. This is where we talked about our isometrics with muscle strains, right?
Okay.
That activating the muscle without actually moving the joint. So
Hmm.
how you can slide your foot up against a wall and kind of push your toe into the wall. It's going to activate my calf
Okay.
without making me go into like a very forced plantar flexion or anything like that.
Right.
So those are kind of what we're really focusing on in that acute phase. Um, are we doing a lot of stability training in this phase? It depends, right? So
Hmm.
usually, it's just stability, especially at the ankle, it's great to do it weight bearing.
Hmm.
So if we're not quite at that phase, then maybe not. But it can like as we progress through those couple weeks, like that stability training initially can be as simple as standing on one leg when you brush your teeth.
Yeah.
You know?
Yeah.
Just
Yeah.
like
For sure.
starting to implement those type of, or when you're washing the dishes,
Hmm.
marching when you're washing the dishes,
Yeah.
that type of stuff.
Yeah.
Yep.
Yeah. Yeah. And it's good to reiterate with that the isometric portion in that acute phase, because again, the tissue is still trying to heal, and we don't want to, if we force it, into a range of motion, we can potentially slow down that healing process by, you know, pulling those healing tissues apart.
Right.
So I think that's a really, really good point for people to understand. Even if again, like you don't have pain and you're just like, okay, cool. Like I saw a program and it was just like do some calf raises or whatnot. But, and then also knowing the mechanism of like where that actual ligament is going to be stretched
Yeah.
to. And that's why like it's not on you to know exactly that. That's why it's like if you want to have that process, done by somebody, make sure you get it done by a professional that's actually worked with people in those injuries, and not just have had that injury themselves and we're just like, oh, this is how this is how I healed my injury.
Yeah.
Because a lot of times, like people will do that, especially in this day and age. And this is what we're doing this for too, is to make sure that you hear the nuance behind it,
Mhm.
that you don't just go and follow a random program without like getting an assessment or knowing like the credentials behind that person, if they've actually worked, if they're going to give you way more details inside of that program that says like if this then that. When they're giving you these things, like you have to know the nuance in what your situation actually is too, what you're trying to get back to.
Right.
Um because if you just do a random program, then they may have you on an accelerated track that worked for them,
Right.
but it may not work for you. You may need way more your severity,
Yeah,
right?
it's on a
Like,
spectrum.
yeah,
Yeah.
the severity of your injury maybe even a lot more. So, from a grade 1 to a grade 3, you don't know.
Mhm.
Um, but we did give you some descriptions on how you can kind of tell, but you always want to get it assessed first and foremost. Don't just let that thing sit. Okay. Getting back into it. All right. So, phase 2, subacute.
Yep. So, and this is kind of where it starts to become a little more individualized, right? Like, how is this person healing? The body, everyone's different. Everyone heals differently. What are their stressors in their lives? How is their diet? This is where, like Fred was saying, having a professional on your side throughout this whole process is important. Yes, the programs online, they're not all terrible. Don't get me wrong, but they aren't assessing the stress levels that's going on in your life that can
Mhm.
affect healing. They're
Yeah.
not assessing the possible nutrition mistakes that you might be making that are affecting your healing. They're not assessing your sleep habits that could be affecting your healing.
Mhm.
You see the pattern here, right?
Yeah.
So, anyways, but yes, that subacute phase that we're looking into all of that.
Mhm.
And then we're progressing the person based off of their personalized journey. We are going to start some concentric based strengthening in a sense here, right? So we talked about isometrics, not actually moving the joint.
Mhm.
Now we're going to start taking that joint through a little more range of motion, right?
Mhm.
Ideally, we're getting it into a load bearing position at some point. Maybe it's just body weight at first, but then we are starting to slowly move into weights and loading upon, within tolerance. This is where bands become a really good starting point, right?
Mhm.
Taking full range of motion, we're really trying to restore normal range of motion at this point, where we've kind of passed the point of allowing these things to not be stretched, but we are getting back into gently stretching them to gain full range of motion and also to get them to remodel, right?
Mhm.
They remodel under tension, under load, under these type of things. So we need to be implementing all those things. Basically, subacute is building the foundation for the strengthening phase.
Got it. So seeing that the tolerance level
Mhm.
at that point in time and
Yeah.
what it can tolerate. Um yeah, no,
Mhm.
good stuff. And we're getting into some balance stuff now
Yeah.
too.
Oh,
A
yes, of
little bit
course.
more balanced stuff now.
Yep. Absolutely.
So more like actual prescribed balance stuff instead of like, okay, hey, like if you're, at the sink and you're brushing your teeth, like kind of stand on one foot or, and get into a split stance or something. But now it's like, okay, we're going to give you like split stance, kettlebell switches or whatnot.
Yeah, we're gonna try and make it a little more dynamic. We're gonna
Yeah.
make it load bearing. Yeah, those
Yeah.
type of things. Yep.
Yeah.
Yep.
Good. All right. And now phase 3, strengthening.
Phase three. Yep. This is kind of
Fun
this fun
stuff.
phase. Yeah, it's the fun phase. So you should really primarily be out of pain at this point. We should have the swelling under control. Hopefully, we've gained back almost all the range of motion at this point, so that we can work within the range of motion. But yeah, we're loading. We're getting strengthening. And again, if we're talking about the ankle, like that's not just heel raises. It's important, right? But we're working the side of the leg, your everters. So we're doing a lot of toe out type stuff. We're also doing functional movements. So we're getting them back into squatting movements. We're getting them back into deadlifting movements. And yes, and this is where we further progress the stabilization, the proprioceptive awareness with ligament strains, or with ligament sprains. That should not stop, right? So that should just keep getting more challenging,
Right.
right? And that can be basically combined with strengthening. Maybe we're doing single leg deadlifts, right?
Yeah.
But
Yeah.
we really need to be challenging the stabilization and the proprioceptive system throughout the entire rehab process.
Right.
That should not stop advancing, especially for a ligament sprain where we have lost a little bit of our passive stability,
Yeah.
right?
Yeah. Yeah, so I would say think about it like this. So if you have getting into some exercises, so you can kind of like wrap your head around it. So instead of doing RDL. So a barbell RDL. So you got both feet in alignment with each other. Instead of doing the barbell RDL, now maybe we do a staggered stance
Mhm.
barbell RDL. If that feels good, that's okay. Maybe we do a single leg barbell RDL, which is very challenging because the weight is very far away from the body. I've tried these a couple of times, and I was just like, yeah, I don't know if I'm going to give these to any of my clients at all,
Yeah.
but I have recently. But you can see that it's going to be way more challenging on the balance the more that you start to go into that single leg movement and the loading as well, right? So we're putting a lot more load into that movement also, which you're going to have a lot more load if you're doing a sport that's very dynamic,
Mhm.
that you're going to be on your feet for. So you need to already get that under your belt for
Yeah.
sure.
And even changing. So, you think of RDLs, kind of like this very, very frontal type
Yeah, yeah, yeah.
movement, right? Which is great, for our CrossFitters, our functional fitness
Right.
athletes.
Yeah.
Yes, we function in these
Pretty
planes right here, just like this.
much.
That's not every sport, though, right? Yeah. If you're going back to soccer
Yeah.
or football or something like that, I mean, we have to be challenging that joint in angles
Yeah.
and lateral movement and rotational movement. Like
Hmm.
the joint needs to be to be very secure in all
Yeah.
angles.
Yeah.
For sure. I mean, it should be for CrossFitters too.
Yeah.
It's
For sure. Yeah,
we're just a little
definitely.
more frontal plane.
Yeah. Yeah. So with that in mind, they might be asking like, oh yeah, so what would that look like? It could simply be just a lateral hop
Mhm.
and stick, right? And then it could be a lateral hop and then hop back without sticking the landing. It could be a lateral hop off of a surface. So now like that load is going to be more increased. It could just be as simple as that, doing a lateral hop onto that single leg.
Mhm.
Or even just the lateral hop onto both legs because you're still kind of getting that to
Yeah,
start off
yeah.
with. See, I'm kind of going through it as I'm talking about it, right? So if you're a little uncomfortable with that, then yeah, going both ways. But if you're an athlete and you're used to doing that dynamic movement, then yeah, okay, we're gonna do a lateral hop. Okay, cool, that looks good. All right, let's do it from a little higher of a surface. All right, cool, that looks good too. Maybe a little bit higher. That looks good. Stick the landing. That's fine. Now let's make it a little bit more dynamic or whatnot. And you always just think about like your sporting activity, and that's what we're about to get into right now. So phase 4, return to sport.
Yep. So this is where strengthening continues, stabilization continues, the proprioceptive awareness stuff continues, everything continues. We're now just kind of tailoring it so that it's specific to the sport that you're trying to return to, right? Because we want that joint or whatever that ligament to respond to a specific stimulus, to a specific movement, to an angle, whatever,
Yeah.
right? So this is where this is honestly where a lot of people will drop off,
Mm.
right? Before we get to this phase,
Hmm.
because they're feeling real good. They're feeling strong. Everything's great, right? They drop off, everything feels great. And then they may get injured, pretty quickly afterwards because they return to something that we didn't quite train yet.
Hmm.
We have to build the foundation and then we can train, like we were just talking about lateral movement, rotational stability, right?
Hmm.
That doesn't come first, that comes last. But yeah, like I said, a lot of people will drop off here, or maybe that, if they are in like insurance based clinics, their insurance cuts them off before they get to this sport specific
Yeah.
phase.
Yeah.
Yeah, which is a problem. That's a
Yeah.
huge problem. Like I
Yeah.
said, it's where it's why a lot of people get re injured, especially with the same exact injury.
Right.
That's
Yeah.
which is what I hate to see that.
Yeah. So they get to the strengthening phase. Everything is strengthened,
Yeah.
reinforced, but it doesn't translate to their actual sport because they didn't get to slowly ramp up. It's just like when you're first learning the sport in the first place. Like you're learning the skill a little bit slower. You may not be putting as much load or as much force into it. So the same thing has to happen, right, in the rehab process. And most of the time they may not even get educated on that when it comes to like the insurance based clinics, and not knocking the insurance based clinics at all because there are some really good therapists that actually work in that setting.
Yeah.
It's just the system sometimes sound like a conspiracy here. i don't want I don't want them to come for me right now, but it's just like that specific system just doesn't allow for the proper amount length of treatment,
It doesn't.
right?
No, it does
and
not.
and that's with a lot of different injuries as well. So and this is information for you to kind of take it in with yourself whenever you do, if you are going to go to a cash based, or not cash based because that's way
Yeah,
too I didn't just plug that, but if you are going to go to an insurance based place, to actually talk about like your sport, and if you're
right.
going to get cut off sooner, like have them like, hey, what should I do afterwards, kind of give me some graded stuff to do.
Yeah. Yep.
See if they have any resources for you to go outside of that.
Yeah.
If you're actually working with a coach, maybe that coach may talk to your therapist that you're working with, and they can give them a plan or something like that. So there's a lot of different ways you can work around it if that's your only way to get treatment, right? So
Yeah, you just
yeah,
have to advocate for yourself a little
yeah,
bit. Yeah.
yeah,
Yeah.
definitely advocating for yourself is huge when it comes to our health and well being. Um, all right. So anything else to add on that last phase, to return to sport
No,
and
I don't
activity?
think so. Yeah,
No?
no.
Good.
No.
Yeah, so that's it for ligament sprains. If there is any other questions that you may have about a ligament sprain, maybe it's a specific one, feel free to put it down in the comment section below. If you have any other requests from us, like what you would like to see in future podcast episodes, feel free to put that down in the comment section below, because we actually will take that into consideration and put that in the episode. And if you want to learn more about how Redemption Physical Therapy can help you heal your injury and get back to sport, performance, just life in general, go to redemptionphysicaltherapy.com or simply click the link down in the show notes. And again, thank you for listening, and we'll see you in the next one.